It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Why is a dog's feces hard and then liquid? When a dog's poop starts out solid and then becomes mushy, it is an indication of small intestinal diarrhea. Normal dog feces should be firm, but moist and with a slight odor. Dogs on a high-fiber diet should have bulkier stools. Changes in the consistency of the dog's stool are usually due to the absorption of water in the intestine. In general, diarrhea in dogs can be classified as small bowel and large bowel diarrhea. Characteristics of small intestinal diarrhea. Difficulty and urgency to defecate is rarely observed. Daily frequency of defecation 2 to 3 times higher than normal. Increased volume. Usually there is no mucus. There is usually no fresh blood, but it can be digested blood. Vomiting may occur. Weight loss. Characteristics of diarrhea of the large intestine. Difficulty. Daily frequency of defecation greater than 3 times the normal rate. Urgency to defecate. Presence of mucus. Presence of fresh blood. Vomiting and weight loss are rare. Causes of solid poop that softens. When small bowel diarrhea in dogs causes a dog to have firm stools followed by loose stools, it is a symptom of disease. This disease is one that affects the gastrointestinal tract, but there are several causes. Infectious enteritis, caused by various intestinal bacteria and parasites, including Campylobacter, Giardia, Histoplasma, and Phycomycosis. Bacterial overgrowth. Nephropathy. Liver disease. Hypoadrenocorticism, Addison's disease. Food hypersensitivity. Exocrine pancreatic insufficiency. Inflammatory bowel disease. Protein-losing enteropathy. Intestinal obstruction. Intestinal intussusception. Foreign bodies in the intestine. Intestinal tumors, lymphosarcoma. Adenocarcinoma, fibrosarcoma, leiomyoma. Hemorrhagic gastroenteritis. Lymphangiectasia. Rectal polyps. Diet change. Diarrhea of the large intestine occurs when there are disorders or diseases of the large intestine, such as parasitic or bacterial infections, inflammatory bowel disease, perineal disease, irritable bowel syndrome, neoplasms, lymphosarcoma, colonic histoplasmosis. Symptoms of small intestine diarrhea in dogs. When small bowel diarrhea occurs, hard stools followed by liquid stools are not the only clinical sign. Along with this main symptom, we can also see lack of growth in puppies, weight loss, anorexia, gurgling noises in the belly area, flatulence, abdominal discomfort, melena, digested blood, dehydration, malabsorption, bad digestion, nutritional deficiencies, loss of shine and quality of the coat, vomiting, increased frequency of defecation, fever, lethargy. Generally, when a dog is affected by small intestinal diarrhea, it is worse than when it has large intestinal diarrhea. This is because the latter does not affect his appetite as much. Although he has trouble absorbing nutrients, he doesn't lose as much weight. Dogs can have both small and large intestinal diarrhea. Treatment of small intestinal diarrhea in dogs. Once the diagnosis of why the dog defecates hard and then soft has been established, symptomatic and specific therapy should be applied. Symptomatic therapy is based on correcting nutritional and electrolyte imbalances with fluid therapy. It is especially important to rectify potassium levels. Antidiarrheal drugs can be used to stop diarrhea, but should not be used in case of infectious diarrhea. This is because these microorganisms need to be expelled. In these cases, the necessary antibiotics, antiparasitics or antifungals will be used, as appropriate. Specific treatment. Depending on the disease that causes these symptoms in dogs, a different specific or medical treatment will be used. Chemotherapy, in case of intestinal tumors, or surgical resection. Diet and medications. Vitamins. Surgery, obstructions, or the presence of foreign bodies may require surgical intervention. Treatment of the disease: if there is renal, hepatic, or hypoadrenocorticism disease, a specific treatment for the disease in question should be carried out. Enzymes: if exocrine pancreatic insufficiency is diagnosed, pancreatic enzymes and a digestible diet should be given. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.